So you can hear me? Okay. So let's talk about the new one. Okay, so we are going to talk about a new disease. In fact, it's not a disease. In fact, it's a group of diseases, and we call it autoimmune, polyglandular, or you can even call them polyendocrine, right? So whatever you like to call it, either polyglandular or you can even call it polyendocrine. And this is important, this name, because it gives the idea that only one gland is not involved, only one endocrine gland is not involved, many other endocrine glands are going to be involved. So polyendocrine or polyglandular syndrome. And whenever we talk about this one, right, or very simply we call it the APS. So whenever we talk about the autoimmune polyendocrine syndrome, we have got three very common types that we need to understand, right? The first one is called as the autoimmune polyendocrine syndrome 1, type 1. Then the second one, you can guess what is called the second one. The first one is APS type 1. What is the second one? Autoimmune polyendocrine syndrome type which one? 2. And what is the third one? Autoimmune polyendocrine syndrome type 3. Let me tell you, we don't call it that way, we call it IPEX. Right? So altogether how many types are there? 3 types. Autoimmune polyendocrine syndrome 1, autoimmune polyendocrine syndrome 2, and we have got the third one, we call it IPEX. So now we try to understand them. All of them, they are having the one thing in similarity, that there is not only one disease involved, there are multiple multiple glands are involved, and another similarity is that all of them, they are going to the example of autoimmune diseases. Got idea? So now the first thing you must not forget here, that this disease is the APS type 1. In some books they also call it Whittaker syndrome. This one is also sometimes called as Whittaker syndrome. The APS type 2 is also sometimes called as Ischemic syndrome. Right? The APS 1 is called as Whittaker syndrome, and APS 2 is called as the Ischemic syndrome. And the IPEX is the full form of the IPEX. Let me give the full form of the IPEX. I stands for immunodysregulation or immunodeficiency. Number 1, immunodeficiency. P for polyendocrine or polyglandular. E for enteropathy, and X for, because it is X linked. So immunodeficient or immunodysregulatory, P for the polyendocrine, E for enteropathic, X for X linked. So we call it IPEX. Clear about this thing? Okay, now let's go further. If we think about the Whittaker syndrome, it is generally going to the example of autosomal recessive disorder. This is example of autosomal recessive disorder. While when we think about the Ischemic syndrome, it is going to be the example of autosomal dominant syndrome. And of course you have already learned that IPEX is going to be the example of which linked? X-linked syndrome. And you tell me, if it is the X-linked recessive, then can it happen in the male or in the female? In the male. Female are only going to be the carriers. Not only this disease, any kind of X-linked recessive disorder does not happen in the female, they are only going to be the carriers. Right? So this is going to be autosomal recessive, APS1, APS2 is going to be the autosomal dominant, and the IPEX is going to be X-linked. All be given the full form of IPEX, full form. Immunodeficiency or immunodysregulatory, polyendocrinopathy, E for enteropathy. Means this patient is also going to come to you with the diarrhea. Right? There is enteropathy. Patient will come to you with the diarrhea, and the X for the X linked. Now go further. In case of the APS1, the main gene that is involved here, we call it autoimmune regulatory, autoimmune AI regulatory, RE, right? We call it AIRE, gene involvement. So in case of the Whittaker syndrome, which is the gene involved? AIRE. Give me the full form. Autoimmune regulatory syndrome, and this is going to be present in the chromosome number 21. Right? So it is present in which chromosome? Chromosome number 21. So autoimmune regulatory gene is present in the chromosome number 21, and this gene is having the mutation which is following in the autosomal recessive pattern, and we call it Whittaker syndrome, or we simply call it autoimmune polyendocrine syndrome type 1. Clear about this thing? Now let's go for this one. When you think about the APS type 2, the gene here are multi-gene. So there is not only one gene, there are many genes which are involved here. There are going to be many genes involved in this situation. But the main thing what you have to imagine about the APS2 is that it is also going to have some HLA association. Right, so APS type 2 is going to have some HLA association, and the most common HLA which are associated here is going to be the HLA DQ2, HLA DQ8, and also the DR4. So these are the common HLA associated, the DQ2, which one is the next one? DQ8, and which is the next one? DR4. Okay, what is the thing? So once again, all of you tell me, what is another name for APS1? Whitaker syndrome. And what is the pattern of inheritance here? Autosomal recessive. And what is the gene affected here? The autoimmune regulatory gene, AIRE gene, and this is located in which chromosome? Chromosome number 21. But if you look at the gene for the APS2, it is going to be multi-gene involved here. But here is the HLA association. Which three HLAs are involved? Tell me. DQ2, DQ8, and DR4. Now the important thing for you to remember is the gene that is involved in the IPEX is going to be the, all of you write the name down, we call it the FOXP3. And this gene is going to be located in which chromosome? This is the example of which disorder? X-linked disorder, so it is going to be located in the X chromosome. So the FOXP3, this gene is having one very important function. This gene generally in our body is going to help in the regulatory T cells. And that's why you can see, if the regulatory T cells are not working properly, then patient is going to have the immunodeficiency. Right? So this FOXP3 gene normally in our body is responsible to regulate the regulatory T cells. And if the regulatory T cells are not working properly in our body, then they are going to have the immunodeficiency. Got idea? So till now we have learned very important 3 points about them. So all together, tell me the name of the APS1. What is the name? Whitaker syndrome. Tell me the name of the APS2. Ischemic syndrome. And tell me the full form of the IPEX. Immunodeficiency, polyglandular, enteropathic, X-linked. Then you tell me what is the pattern of the inheritance in this case? Autosomal recessive in the APS2, autosomal dominant in case of the IPEX, X-linked, right? And what is the gene involved in the APS1? We call it AIRE gene, right? Give me the full form. Autoimmune regulatory gene present in which chromosome? In the chromosome number 21. And which is the gene associated in the APS2? There is multi-gene associated, and they are also having the HLA association. Tell me the three HLA association here. DQ2, 8, and the DR4, right? And then tell me what is the gene associated in case of the IPEX? FOXP3. It is going to be having the function for regulation of which cells? Regulatory T cells, and if they are affected, that's why the person is going to have the immunodeficiency. Any question till now? Okay, now the important part we go, that what are the common associations? Keep in mind, whenever a patient will come to you with the APS1, they are going to have three very common associations. Number one, all of them they are going to have this disease. Which one? Addison's disease. Just now we talked about. So it is the example of polyendocrinopathy. Many different autoimmune disorders are associated, and the first important example is going to be which one? Addison's disease. The second example, never forget, the second feature of this syndrome is going to be hypoparathyroidism. So patient may have some autoimmunity causing the problem in the parathyroid gland, and they are going to have the hypoparathyroidism. And the third one is important one to remember. This patient may come to you with the candidiasis. And this candidiasis is mainly because of the mainly going to happen in the mucocutaneous layer, right? So never forget that this candidiasis is going to be the example of chronic mucocutaneous candidiasis. Mucocutaneous candidiasis. So these are the three very common features that we should always think about the Whitaker syndrome or the autoimmune polyendocrine syndrome type 1. Clear about this thing? Okay, now very quickly we go for the APS2. In case of APS2, this goes this way, that this patient must be having this disease. Which disease? Addison's disease. And along with this disease, along with the Addison disease, they may have, either the type 1 diabetes mellitus, or they may have the Hashimoto thyroiditis, right? They may have the type 1 diabetes mellitus, or they may have the Hashimoto thyroiditis, or they may have the both type 1 diabetes mellitus as well as the Hashimoto thyroiditis. But there must be one thing always. What is that? Addison's disease. So patient came to you with the Addison disease and he is having type 1 diabetes mellitus. We said that he is having the APS2. Patient came to you with the Addison disease, he is having the type 1 diabetes mellitus, also he is having the Hashimoto thyroiditis. Again we are going to say that he is having the APS type 2. Clear about this thing? Now the important thing is about the features of the IPEX. And you already know, in the feature of the IPEX, the patient is going to have the immunodeficiency. So he is going to have some sign and symptom of the immunodeficiency, maybe recurrent infection and this kind of feature will be there. Not only that, he is going to have the polyendocrinopathy. So many kind of autoimmune disorder will happen. For example, the Addison disease can happen. For example, the Hashimoto thyroiditis can happen. For example, the type 1 diabetes mellitus can happen. Vitiligo can happen. So any kind of autoimmune disorder can happen to this person. The very important thing you should not forget that this patient may come to you with the enteropathy. And the enteropathy is going to be mainly presenting as what? Diarrhea. So patient may come to you with the diarrhea as well. So this is another very common feature, and this is going to be the IPEX. So in this way we learned about the autoimmune polyendocrine syndrome, right? So altogether, all tell me how many types are there? 3 types. So now I'm going to give you the characteristic and you people tell me what is going to happen in the different category. So what is another name of the APS type 1? Whittaker syndrome. Another name for the APS type 2? Ischemic syndrome. What is another name for the full form of the IPEX? Immunodeficiency, polyendocrine, enteropathic, the X-linked, right? Tell me about the genetics. What is the inheritance pattern of the APS type 1? It is autosomal recessive. And which gene is affected? Autoimmune regulatory gene. We call it AIRE. Which chromosome present in? Chromosome 15, right? And tell me about the association in the APS type 2. What is the pattern of inheritance? Autosomal dominant. And which gene is affected? Many genes. And which HLA association here? The DQ2, DQ8 and DR4, right? And then which gene is associated with the IPEX? FOXP3, right? And then this is located in which chromosome? X chromosome, and it has got one very simple job. Its job is to regulate the T regulatory cells, right? Regulatory T cells, and that's why if it is having the problem, it is going to have the immunodeficiency. So tell me the 3 diseases that is found in the APS type 1. What is the first one? Addison's disease. Second one? Hypoparathyroidism. What is the third one? Candidiasis. It is going to the chronic mucocutaneous type. Tell me the few features of the APS type 2. Addison's disease, and which one? Type 1 diabetes mellitus or Hashimoto thyroiditis or both. And what are the features of the IPEX? What is the first one? Immunodeficiency. Second one is autoimmunity, right? All kind of features, whatever we learn, they can happen. And the third thing is what? Enteropathy, the diarrhea. Clear what I'm saying? Okay, so we stop our class here.